In a move to strengthen Nigeria's healthcare system, the Ministry of Health and Social Welfare, Nigeria's Center for Disease Control and Prevention, has inaugurated the Infection Prevention and Control Technical Working Group to address and reduce the prevalence of healthcare-associated infections. KAFTAN TV correspondent Benedict Uku reports that the Infection Prevention and Control Technical Working Group is responsible for strengthening the country's IPC efforts, aligning with national health priorities and providing the necessary resources and technical assistance aimed at reducing the burden of healthcare-associated infections. Here is the report.
The devastating impact of past disease outbreaks such as Ebola, Lassa fever, and the COVID-19 pandemic, which have exposed gaps in infection prevention and control programs. To close these gaps, the federal government has inaugurated the Infection Prevention and Control Technical Working Group with the focus on strengthening the IPC framework, ensuring that every healthcare facility has the necessary resources to implement effective measures and engaging communities in awareness and good hygiene practices. The Minister of Health and Social Welfare, Ali Pate, represented by the Director General, Nigerian Center for Disease Control and Prevention, Dr. Olajide Idris, noted that effective implementation of IPC and WASH measures are essential in enhancing the country's overall healthcare preparedness and response capabilities.
This inauguration is also integral to our overall national health agenda. Our strategic blueprint aims to save lives and reduce both physical and financial pain and produce health for all Nigerians while advancing towards universal health coverage. With inauguration of this group, Nigeria has demonstrated leadership in IPC and setting precedent for other countries to follow.
The Director General, Nigerian Center for Disease Control and Prevention, represented by Dr. Chukwuma Anyaike, emphasized the importance of participatory approach that empowers healthcare workers to identify problems and propose local solutions.
Our focus will be on strengthening IPC framework, ensuring that every healthcare facility has necessary resources to implement effective IPC measures. From the training and the capacity building of the healthcare workers to policies, guidelines, and also the structured budget which can drive the process. As we inaugurate the National IPC Technical Working Group today, let us reaffirm our commitment as a nation to infection prevention and control. Let us recognize that IPC is not just a set of protocols, but a critical foundation for a resilient health system that delivers quality of care for all.
The World Health Organization representative and others also highlighted the importance of expanding IPC efforts down to the primary healthcare facilities.
And we know that healthcare-associated infections are those avoidable harms that result from healthcare when infection prevention and control are not optimal in hospitals. But I will also say that we also carry a high burden of community-acquired infections as well.
The implementation of this global strategy on IPC is closely related to WHO's recommendations and standards included in the guidance on core components of and the minimum requirements for IPC programs, the essential water, sanitation, and hygiene standards in healthcare facilities.
With inauguration, 70% of healthcare-associated infections is expected to be prevented through effective IPC interventions. This means that every dollar invested in improving hand hygiene can save about $16 in reduced healthcare expenditures.